Now you need to know that what for the joint healing, that is for bone healing. For the joint healing, you have to know that in the upper limb, joint healing, the upper limb, it means that if you have an elbow dislocation or you have a shoulder dislocation in the upper limb, it takes half that of the bone healing for the upper limb. So the half of 6 is going to give you 3 weeks. So 3 weeks for the upper limb of joint healing. Is it clear? So if you have an elbow dislocation or you have a shoulder dislocation, it takes complete 3 weeks in adults. Also, for the lower limb, you have a femoral dislocation, a hip dislocation, or you have a knee dislocation. It's going to take half that of 12 weeks, which is going to be 6 weeks for the lower limb. Is it clear? That is for adults. Now, the next thing is going to be in children. Bone healing. Let's start with bone in children. The upper limb bone healing, it takes half that in adults. So it takes what is called 3 weeks in upper limb for bone healing. Is it clear? So bone healing for children in upper limb takes 3 weeks. And then bone healing for children in the lower limb takes 6 weeks, half that of adults, 6 weeks in children. Is it clear? So bone healing is faster in children than adults. Now the next thing is that you have also joint healing in children and adults. Is it in children now? For the upper limb, the joint healing in children takes half of that of the upper limb of bone healing. So half of 3, it gives 1.5 week. Is it clear? 1.5 week for the upper limb joint dislocation or shoulder dislocation, elbow dislocation is going to heal in children. And then for the lower limb, half of the lower limb time, that's the duration is 6 weeks. So it's going to take 3 weeks for you to have a complete healing of a femoral dislocation or a knee dislocation. Is it clear? So those are the things that you have to understand. The next timing that you have to understand for the bone is the next timing that you need to understand. The next timing that you need to understand is the timing now of the formation of the hard callus. Is it clear? The timing for the formation of the hard callus is extremely important. Is it clear? The timing of the formation of hard callus is extremely important. And why is the timing of the formation of the hard callus important? It is important because you need to target the time of the hard callus formation in order to prevent excessive hard callus formation. Is it clear? So that's when you have to start immobilization. When there is a conversion from the soft callus to hard callus, you should shift from immobilization to mobilization. I hope you are getting, because when we were speaking about bone healing process, we said that the soft callus is first formed and then the hard callus is later formed. But the problem with the hard callus is that soft callus is that it is soft. So if you mobilize the limb at that time, it's going to get destroyed. Is it clear? So we want to immobilize completely the limb at that time of the formation of the soft callus. And now in the case of a hard callus, the problem with the hard callus is that it is hard. If it get excessively mobilized, you're going to have a bone that is easily blistered. It's going to be hypertrophying, going more than its borders, and then it's easy going to get fractured later on in life. Is it clear? Because this is not like the normal bone. Is it clear? It needs to be remodeled for it to get like a normal bone. And for the remodeling to take place, you have to do mobilization. So the timing of the start of the hard callus is a half of the time of the duration of time of the healing of the bone of upper or the lower limb. So what do I mean? If you have a fracture of the humerus, that's in the upper limb, is it clear? Normally in children, the fracture takes 3 weeks in order for it to heal. So the hard callus is going to be formed by half of 3 weeks in children. That's 1.5 weeks of the upper limb in children. While the hard callus start to be formed in half of 6 weeks in adult, that's 3 weeks in adults for the upper limb. Now, for the lower limb in children, we say that the complete bone healing takes 6 weeks for children in the lower limb. So the hard callus formation start at half of that 6 weeks, which is 3 weeks for the lower limb, and it also start half of the lower limb in adult, that is 6 weeks for the adult. So what does it mean? It means that when you want to start rehabilitation, you start rehabilitation in fractures of the upper limb in children as from 1.5 weeks. So for the first 1.5 weeks, the arm of that child should be completely immobilized. Is it clear? And after the 1.5 weeks, you can now start mobilization. So mobilization of the joints, is it clear, to prevent stiffness and to prevent excessive growth of the hard callus. Is it clear? So that is one. The next point is in adults, is it clear, for the upper limb, immobilization has to be complete for 3 weeks, and then mobilization start as from 3 weeks going up to 6 weeks, and at 6 weeks now the patient is completely healed. You completely remove the cast. Now in lower limb in children, mobilization start as from 3 weeks. It means that less than 3 weeks there is complete immobilization. Child is not moving at all the limb, and then after 3 weeks we have now mobilization. And now the next one is for adults. For the lower limbs, immobilization is complete for 6 weeks, and then from 6 weeks to 12 weeks you have some mobilization, that's 2 to 3 times per week of physiotherapy, and afterward, after 12 weeks, the person is said to be healed. Now let's come back to the different elements or the different late complications. Is it clear?